Everyone gets sick sometimes, but some illnesses can be so dangerous that they take your life if you don't do something about them. To protect yourself and your loved ones from dying from diseases, you need to know about the most deadly diseases and how you can prevent getting them today. The leading causes of death worldwide are non-communicable diseases or NCDs such as heart disease, stroke, diabetes, cancer, chronic respiratory diseases, and dementia. These diseases claim 41 million lives each year. That's 71% of all deaths globally. This number includes over 9 million deaths from cancer, 6 million from diabetes, 4 million from heart disease, and 1.9 million from chronic respiratory conditions. More than half of these deaths occur prematurely, which means they happen before someone reaches the age of 70. It's sad to think that many of these deaths could have been prevented. So let us discuss some of the deadliest diseases that can kill you quickly and how to prevent them. Cancer is a scary word we often hear at doctors' offices. But what exactly is it? Cancer is a disease that happens when cells begin to multiply rapidly and uncontrollably. They start forming tumors and spreading to different parts of the body. There are over 100 types of cancer, and they all affect people differently. But there are some common signs. Cancer can lead to tiredness, weight loss, fever, and pain. It's important to remember that not everyone with these symptoms has cancer. These symptoms might be caused by other conditions, too. And many cancers don't cause any symptoms in the early stages. Regular checkups and screenings are essential to catch cancer early when it's most treatable. If you notice any concerning symptoms, talk to your doctor right away. Early detection and treatment can make a huge difference in the outcome of cancer. Heart disease is a condition where the arteries that supply blood to the heart become narrow or blocked. This blockage restricts blood flow to the heart muscle. When this happens, the heart doesn't get enough blood and oxygen, leading to chest pain or a heart attack. Heart disease can also lead to heart failure, where the heart can't pump blood effectively. Several factors increase the risk of heart disease, including high blood pressure, high cholesterol, smoking, and diabetes. Eating a balanced diet, staying active, and managing stress levels can all help lower the risk of heart disease. Many types of heart disease can be treated and even cured with medication and lifestyle changes. However, some types of heart disease can cause permanent damage to the heart muscle. This highlights the importance of prevention. By taking steps to lower your risk factors, you can significantly reduce your chances of developing heart disease. A stroke occurs when the blood supply to a part of the brain is interrupted. This can happen when a blood vessel in the brain becomes blocked or when a blood vessel in the brain bursts. A stroke can cause brain damage and disability if it isn't treated quickly. Some common symptoms of a stroke include sudden weakness or numbness in the arms or legs, dizziness, difficulty speaking, and loss of balance. Recognizing the signs of a stroke and seeking medical attention fast is crucial. It can help reduce the severity of the stroke and its impact on your life. Doctors use medicines to break down blood clots and restore blood flow to the brain. They may also recommend surgery to remove a blood clot or repair a damaged blood vessel. Rehabilitation is essential after a stroke. With physical therapy and occupational therapy, survivors can learn to manage their symptoms and regain independence. Chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease, COPD, is a group of lung diseases characterized by inflammation and narrowing of the airways. This makes it hard to breathe and can cause symptoms like wheezing, shortness of breath, and chronic cough. COPD is usually caused by long-term exposure to irritants like tobacco smoke or air pollution. Over time, these irritants can damage the lungs and airways, leading to inflammation and narrowing. This makes it harder to breathe and can cause symptoms like wheezing, shortness of breath, and a chronic cough. People with COPD may also develop frequent respiratory infections, which can further damage the lungs. There is no cure for COPD, but treatments are available to help manage the symptoms and improve quality of life. These include medications, pulmonary rehabilitation, and oxygen therapy. Dementia is a general term for a decline in mental ability severe enough to interfere with daily life. It affects memory, thinking, behavior, and the ability to perform everyday tasks. Alzheimer's disease is the most common cause of dementia. Other causes include vascular dementia, Lewy body dementia, and frontotemporal dementia. Dementia can cause changes in mood and personality, as well as problems with decision-making and language. As the disease progresses, people with dementia may become confused, disoriented, and unable to care for themselves. Currently, there is no cure for dementia, but treatments are available to help manage the symptoms and support those living with the condition. Diabetes is a disease that affects how your body regulates blood sugar. It happens when your body can't produce enough insulin or when your body can't effectively use the insulin it produces. Insulin is a hormone that controls the amount of sugar in your blood. Without insulin or with insufficient insulin, the sugar builds up in your bloodstream rather than being used by your body's cells for energy. High blood sugar levels over time can damage various organs, especially the eyes, kidneys, and nerves. Diabetes can lead to complications like heart disease, stroke, and vision loss. There are two main types of diabetes. Type 1 diabetes is an autoimmune disease where the body mistakenly attacks the cells that produce insulin. Type 2 diabetes is the most common form, and it happens when the body becomes resistant to insulin or doesn't produce enough. While there is no cure for either type, various treatments can help manage symptoms and prevent complications. For type 1 diabetes, this includes insulin therapy. For type 2 diabetes, lifestyle changes like diet and exercise, as well as medications, can help control blood sugar levels. Asthma is a chronic respiratory disease that affects the airways of the lungs. It causes inflammation and narrowing of the airways, which makes breathing difficult. Asthma can cause symptoms like wheezing, coughing, chest tightness, and shortness of breath. These symptoms can be triggered by various things like allergies, exercise, cold air, or respiratory infections. During an asthma attack, the airways become swollen and filled with mucus, making it hard to breathe. Asthma can be controlled with medication. Inhaled corticosteroids reduce inflammation in the airways, and bronchodilators relax the muscles around the airways to help open them up. Pneumonia is an infection that causes inflammation in the air sacs of the lungs. This can make breathing difficult and cause symptoms like a cough, fever, and chills. Pneumonia can be caused by bacteria, viruses, or fungi. It can range from mild to severe and can even be life-threatening. The most common way pneumonia is spread is through breathing in the air sacs of an infected person who coughs or sneezes. It can also be spread by direct contact with an infected person or by touching contaminated surfaces. Symptoms of pneumonia can include a high fever, chills, a cough, difficulty breathing, and chest pain. Treatment depends on the underlying cause and can include antibiotics for bacterial pneumonia and antiviral drugs for viral pneumonia. Tuberculosis is a bacterial infection that most often affects the lungs. It's spread through the air when an infected person coughs, sneezes, or speaks. TB can cause symptoms like a bad cough, chest pain, fever, night sweats, and weight loss. If left untreated, it can be life-threatening. TB is diagnosed through sputum test, a skin test, or blood test. Treatment usually involves a combination of antibiotics taken over a period of several months. Influenza, commonly known as the flu, is a viral infection that affects the respiratory system. It's spread through droplets in the air when an infected person coughs or sneezes. Flu can cause symptoms like a fever, cough, sore throat, muscle aches, and fatigue. While flu is usually not as serious as pneumonia, it can still lead to complications like pneumonia and bronchitis. The best way to prevent flu is by getting the annual flu vaccine. This helps reduce the risk of getting sick and can also lessen the severity of symptoms if you do get sick. How to prevent deadly diseases. Adopting a healthy lifestyle is key to preventing deadly diseases. This means eating a balanced diet, exercising regularly, avoiding tobacco, and limiting alcohol intake. Being physically active strengthens your heart and lungs, reduces stress, and helps maintain a healthy weight. All of these factors play a significant role in lowering the risk of heart disease, stroke, diabetes, and other deadly diseases. Regular checkups and screenings are also essential for early detection and prevention. This is especially important for detecting conditions like cancer and heart disease early when they are most treatable. By taking proactive steps to manage your health, you can significantly reduce your risk of developing deadly diseases. Don't wait until it's too late. Start taking care of yourself today. Your future self will thank you. If you found this video helpful, please like, share, and subscribe for more informative health videos. Stay healthy.